Could the Omicron variant mark the new wave of COVID-19 behavior? While a series of changes in the severity of the virus, coupled with new guidelines issued by the United States Centers for Disease Control and Prevention for quarantine, beg the question. Keishla Adderley discusses with Dr. Nikia Forbes what the science has to say.
Since COVID-19 emerged, a 14-day period of quarantine has been standard for infected persons. But the U.S. Centers for Disease Control announced its recommendation Monday that the COVID-19 infected need only to isolate for 5 days, as opposed to 10 if they exhibit no symptoms. The U.S. health regulator also recommending a 5-day quarantine for those who are vaccinated, and for people who are fully vaccinated and boosted, no need to quarantine at all. Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nikia Forbes, explains that the new protocols are based on a combination of science and economics.
There is a push. If people can come out of isolation faster, that will help for persons to get back to work so that essential services can continue. But that has to be balanced based on scientific data. And the CDC did come out and explain that when they look at transmissibility of COVID in their country, it's more likely to happen in the first couple days after the person gets it and they're still asymptomatic, or in the first few days when they have symptoms.
The Omicron variant is blamed for the Christmas Day swell in cases, a record 330. But Dr. Forbes advises that that number is likely not a one-day total.
But they did not all get tested in a 24-hour period beforehand. So indeed, those cases were tested in 2 to 3 days before the report date. And that can happen sometimes because there can be a lag of when labs report positive results in. That being said, that still is a large number of cases in that last week. When we look at the total cases reported that week, that was still a record for us.
In the meantime, local health officials are awaiting key data on Omicron and its less severe symptoms now being assessed by the World Health Organization and others. Specifically, what it means for the potency of the virus.
The finding that cases could be milder, it may be a little too early to extrapolate that across the board everywhere. And the reason for that is because, first of all, the South African population was younger. Is generally younger, and when the United Kingdom analyzed what was happening with their Omicron situation, they found that the population who largely had it was younger, in the age group 20s to 30s, and they generally do better with COVID than older persons. And so we have to be careful. We can't necessarily extrapolate it across the board.
Dr. Forbes notes that it's too early to say that a weaker Omicron signals a weakening COVID-19 virus. Meantime, given the CDC's departure from the months-long quarantine norms, what could this mean for the Bahamas?
Well, we're in the process of reviewing that in our technical team, and as these recommendations came out yesterday, and we understand the context for it, we will review it and determine whether or not it would be applicable for our situation, understanding that it is not zero risk for there to be some transmission in that scenario.
Keishla Adderley, ZNS Network News.
If you missed anything, we've got you covered. Subscribe to our ZNS Network YouTube channel and follow us on our social media platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.